Hello and welcome to Crack the Boards. This channel is dedicated to helping you excel in the USMLE by offering over 2,000 questions, complete with answers, detailed explanations, and the rationale to deepen your understanding. We upload 2 new videos every week, so be sure to subscribe, like, and share to support the channel, stay updated on the latest content, and help others discover this valuable resource. In today's video, we will focus on the USMLE questions related to gross anatomy and embryology. Let's look at the first question. 7 weeks following treatment for a severe streptococcal infection, a 13-year-old girl presents for a follow-up examination. The physician focuses on the 5th intercostal space just below the left nipple during the checkup. What is the most likely finding upon auscultation in this region? A. Aortic semilunar valve sound. B. Bowel sounds of the large intestine. C. Mitral heart valve sound. D. Pulmonary semilunar valve sound. E. Rales of the upper lobe of the left lung. The correct answer is C. The sound of the mitral valve closing is best heard at the 5th intercostal space, just inferior to the left nipple. The mitral valve is responsible for closing the left AV canal. Rheumatic fever, often following a streptococcal infection, can lead to mitral regurgitation or stenosis. Let's have a look at the reason behind not selecting the other options. A. Aortic semilunar valve sounds are heard to the right of the sternum at approximately the 2nd intercostal space. B. Bowel sounds of the large intestine are heard at the mid-region of the abdominal wall on the right or left side. D. Pulmonary semilunar valve sounds are heard to the left of the sternum near the 2nd rib. E. Rales of the upper lobe of the left lung are heard superior to the 5th rib and more laterally along the thoracic wall. Let's have a look at the second question. A 13-year-old girl suffers a closed comminuted fracture of the midshaft clavicle. 1 month later, she visits the clinic reporting intense pain in the left shoulder area and heightened sensitivity to light touch. Which nerve is most likely entrapped and compressed within the fracture callus? A. Accessory nerve. B. Axillary nerve. C. Dorsal scapular nerve. D. Supraclavicular nerve. E. Suprascapular nerve. The correct answer is option D, supraclavicular nerve. The supraclavicular nerve arises from C3 and C4. These nerves are the only nerves that are located over the clavicle and can be caught in formation of callus of the fractured clavicle. Fracture fragments may exert pressure on some parts of the brachial plexus, and the supraclavicular nerves may be caught in the callus formation. Let's have a look at the reason behind not selecting the other options. Accessory nerve is incorrect, as the accessory nerve lies 5 cm above the clavicle, innervating the trapezius muscle. Axillary nerve is incorrect, as the axillary nerve is near the surgical neck of the humerus and is vulnerable in proximal humeral fractures or shoulder dislocations. Dorsal scapular nerve is incorrect as the dorsal scapular nerve runs deep to the levator scapulae and rhomboids, passing through the posterior triangle above the clavicle. The suprascapular nerve is incorrect as it travels through the posterior triangle of the neck above the clavicle to the suprascapular notch. This nerve is not likely to be injured as the result of a clavicular fracture. Let's have a look at the third question. A 34-year-old woman who has had 3 children delivered via cesarean section experiences sudden, painless, heavy vaginal bleeding at 32 weeks of her 3rd pregnancy. Ultrasound reveals the placenta implanted in the lower uterine segment, partially covering the internal os. The obstetrician plans to manage the condition with blood transfusions and tocolytics to delay labor until 36 weeks, followed by a cesarean delivery. What condition is most likely affecting the patient? A. Placenta accreta. B. Placenta increta. C. Placenta percreta. D. Placenta previa. E. Placenta abruption. Now the correct answer is D. Placenta previa. A placenta close to or overlying the internal os is known as placenta previa, which is characterized by painless vaginal bleeding during the 3rd trimester. The abnormal placement of the placenta almost always prevents a normal vaginal delivery. Let's have a look at the reason behind not selecting the other options. A. In placenta accreta, the placenta directly adheres to the superficial part of the myometrium without an intervening decidual layer. B. In placenta increta, the placenta directly invades and adheres to the myometrium. C. Placenta percreta is a more serious form of placenta accreta in which chorionic villi penetrate to the full thickness of the myometrium beyond the uterine serosa. As a result, the placenta may become attached to the bladder or rectum. E. Placenta abruption is premature separation of the placenta before delivery. It presents with painful vaginal bleeding and fetal distress. This concludes today's set of questions. Thank you for watching today's video. If you enjoyed it, please don't forget to subscribe to the channel to stay updated on our latest content and support our journey. Your support means a lot.